Okay, welcome back to Kuleana Community Talk Story. We've had some very good presentations thus far, and I'm excited to hear today's presentation by Randy. Randy Kurohara really doesn't need any introductions, but I'm gonna try. and the bio that he sent was so modest that I'm gonna say a lot more than what he said.
You can have Vanessa do it if you want.
And so in the bio, he does say that he's the executive director of Community First, is what he's talking about today.
Mm-hmm.
But he's also the owner and president of Creative Arts, Aloha Grown. He sits on many boards, including the Hilo Medical Centers Board and Salvation Army Board. And he has been past president for many organizations like the Hawai'i Island Chamber of Commerce, the Japanese Chamber of Commerce and Industry, and Rotary.
Yeah.
So today he's going to talk about health policy and health status here locally in Hilo and on the Big Island. And he titled today, Kuleana Health, Our Responsibility for Health. Without any further ado, please welcome Randy Kurohara.
Hey, thank you. Thank you, Kobe. Appreciate that. Man, thank you so much.
Thank you for coming.
Aloha. Aloha. First off, thank you for your time today. I know everybody's got a full schedule of school, but I appreciate you making time to be here today. And I want to make a disclaimer up front. I'm not a doctor, although I'll be talking about healthcare. I don't have a public health degree. But I say this, for the past maybe 14 years, I've been working with and in around the healthcare sector. I had spent some time working with the Kinoe administration as an R&D director. During that time, I had the opportunity to start up what they call a Mayor's Healthcare Task Force. So I was able to work with a lot of the leaders here on Hawai'i Island with regard to healthcare. In between that, like Kobe mentioned, I've been serving on the Hilo Medical Center board, so I do understand, certain levels of healthcare. And then since 2021, my role with the organization with today. I did want to, recognize Vanessa, because I had an opportunity to work with Vanessa for a couple of years, and it was a wonderful experience. And now she's here at the university, and you guys are lucky to have her here. Just growing up, my oldest brother, who's a family doctor here in Hilo today, but I was able to watch him from when he was, high school, college, and going to med school, coming back to Hilo, starting up his practice here, and just the amount of sacrifice, the amount of debt they get into as a med school student, those years of education. But the hours that he would work, and how the sacrifice was to be a family practice doctor, here in Hilo. Definitely, I could see that, why so very few people would do it, because it really it's a sacrifice, but it's part of someone's purpose in life, I feel. And not to say that times have changed today, but when you look at people entering the medical field today, a lot has changed, right? I think there needs to be a balance of work and life in general. So many doctors today choose to be employed versus independently, like your own business owner, So that model of healthcare, the private practice provider, has really suffered over the last couple decades, and mainly for a lot of different reasons. It's not for people not wanting to go into the field, but it's just tough being in medicine in that business model today. But that being said, I want to talk about our presentation today. It's really about Kuleana Health. So when I saw the title of the talk story series, I was like, okay, that kind of is up our alley, right, Vanessa? Kuleana Health. So anyways, a little bit about our organization, and let's see if I got this. Okay, so for our Community First Hawaii, we convene stakeholders. So this is like medical, social service providers, policymakers, our elected officials, government officials, and really our goal is to drive initiatives that can improve the health of our community. So we address a lot of barriers that isn't something that you could solve alone. Like it takes like partnerships, collaboration. Therefore, that's why like an organization like us exists. The vision, quite different vision, is really Hawai'i Island, where all of us like embrace our Kuleana for our own health. We take responsibility for our own health and the well-being of others, which is really how it's kind of interesting. But this is kind of like my talk today about dealing on with the system side of things, but how at the end it really comes back to what each and every one of you can do. Okay, so the organization was founded in 2014 by Barry Taniguchi, the late Barry Taniguchi. He passed away in 2019, but president of KTA Superstores, very like community leader type person, right? Since his passing, his son Toby has taken over as the board president and chair. So we have really good leadership. Our board consists of many of the leaders that serve our bigger organizations here on Hawai'i Island, hospitals, clinics, and so forth. And then the work that we do really kind of comes down in like 3 areas. So the first one is access to care, which is really working with the providers on increasing access, right? The second area is around health literacy. So that's about like educating our community about ways that they can empower themselves more with regard to health, whether individual or for your family. And then the third area is we convene networks. So we build networks. So one of the networks that we're kind of known for is called the Community Action Network. The Community Action Network is made up of, I would say not necessarily the leaders, but these are more case managers or more the boots on the ground folks in our social services and our medical services here on Hawai'i Island. And the reason for that is, these are the people that are, day to day, they're sort of on the front lines, they're dealing with patients, they're trying to, make a difference within the system that we have. But a lot of times, because everything's so siloed, a network is a great place to bring everybody together, right? You can talk about, what's working, what's not working, how can we connect people better. And with the lens of like, if you have a patient that has needs, right, that is beyond maybe a medical need, they need transportation, they need housing, they need food. How do you connect the different providers, social service providers, so that patients can get the resources that they need? Okay, so today, and this is, sorry man, I didn't put these slides together, but it's kind of what I want to talk about today. It's really, what we're trying to do is really shift the goal of healthcare from treating disease to keeping people healthy, right? And I think that's something that throughout the decades, I think we kind of lost track of that. And a lot of it has to do with just the way things are being paid for today and all that. Healthcare sometimes, right now, let's say it's based on a fee-for-service basis. So most places you go to, if you're in a hospital or in a clinic, a lot of the care given, or the way they're being paid, is by seeing a patient, right? So the more patients I see, the more I make as an organization, as a provider, as a practice, as a hospital, right? So in that sense, it kind of like shifts the incentive the wrong way. It forces organizations to treat disease as a goal versus really necessarily trying to keep people healthy, right? So if you got paid to keeping people healthy and out of your clinic, you might think that, well, if I'm a clinic owner and if the goal is to not have them ever come back, then I might be out of business, right? But we need to find a way within our medical payment models to make sure that that should be the goal, that you can still exist as a hospital, as a clinic, but the goal should always be to keep people healthy, right? So anyway, this just kind of explains a little bit about why the incentives are different. So on a value-based care model, right? Your goal is to create better patient outcomes, right? Improve care coordination, increase quality of care. So you're actually paid for performance in this way. Whereas in fee-for-service, I think it lacks a lot of that stuff, right? So it's more expensive healthcare, lack of accountability, incentivizes more services, right, that may be necessary, and there's a high administrative cost. So all of this is leading up to my main point, which is our system is broken. And I think this is something that many of you know. So if you've been around healthcare, you've, even if you're not, I mean, if you just Google it, I mean, the US today is, one of the wealthiest nations, right? We spend like one of the highest cost, I mean, spending on healthcare is so high, but our outcomes is very poor, right? So, yeah. So we're more than double the average spending of most of our similar type countries, most of the other like wealthy countries in the world today, the US spends twice as much. And if you can look at here, life expectancy versus spending, how much we spend, yet our outcomes is much poorer, right? So something's wrong with the system that we have, right? And I think it's been recognized for years. My predecessor in the organization that I'm with, so I started at Community First in 2021, but prior to me, there was my former executive director. He had a famous line of always saying, the house is on fire, guys, like it's urgent, right? We got to change something here. And then I used to make fun of him. It's like, yeah, the house already burnt down, right? Because it's like, it's been years. But to make that change is difficult because there's so much pressure from whether it's special interest groups or those that are profiting from the current model to make the changes that are necessary, right? Okay, hang on here. Okay, so on a national level, right, I can explain a little bit about, what we're seeing there. In Hawaii, what we do know in Hawaii is that Hawaii is ranked one of the healthiest states in the nation. It has one of the lowest healthcare spend. Like we spend probably the least of all the states, right? So our healthcare spending is low. Our typical health scores is good, right? So you may think, well, it doesn't seem like it's broken in Hawaii because we seem to be scoring well. But I think that when you look at it, there's sort of like two different stories being told. There's sort of this urban Oahu story where, you have access to a lot of care there, right? You live in a city, you drive a few minutes here and there, and you're at any service that you want. It's available, it's there. And I hate to say it, but they say in Hawaii, like your health is determined by your zip code, right? So your life expectancy can be determined by your zip code. And a lot of it is because, most of Hawaii is in a rural setting, right? So, not most, but a good part of Hawaii, right? So outside of urban Honolulu, even Waianae, Kailua, the North Shore, but even then you go to the neighbor islands, it gets even worse, right? So a lot of services you can't find on our island, you're flying to Oahu. So there's the sort of that two different sides of Hawaii. One of my employees who was helping with the slide deck, she was sharing that she worked in Japan, and then she would tell people like, when people come to Hawaii from Japan, they see, they picture Waikiki Beach and, the sun and the sand and all that. But right down the road, you go to one of those parks where all the homeless tents are and all that, and that's the other side of Hawaii, right? And I think in healthcare, it's similar. So if you live in, Molokai or Lanai, right? I mean, you got to fly to even cut your hair, you know what I mean? So healthcare is, for those that can afford it. Hawai'i Island, right? We have, nice hospitals on Oahu, but if you live in Honoka'a, you have a critical access hospital, which is something that's, just like a ER, a very simple ER, and that's about it, right? Then the transport you to Hilo Medical Center or Queens, North Hawaii, right? So you have these sort of health centers in different communities that are designed not necessarily to provide a full range of service, but just simple things that can patch you up until you can get to an acute hospital, right? So on Hawai'i Island, the kinds of healthcare organization or facilities that we have acute hospitals, which these are the ones that have your ERs, your cardiology type services. These are where you go to if you have a bad auto accident or you're having like a real emergency, right? This is where you end up, is one of our acute hospitals. We have Hilo Benioff Medical Center on this side, Queens North Hawaii Hospital in Waimea, and Kona Community Hospital in Kona. Then you have your critical access hospitals. So these are offshoots of some of the other hospitals, and it's mainly a place where you get patched up and then sent to these other places. But Ka'u has one, Honoka'a, and then Kohala. Then we have our federally qualified health centers, our FQHCs. Some of you may be members or patients of these clinics. They're funded through federal payment models. So we have the Hawai'i Island Community Health Center, which today is one of the biggest in the state of Hawaii. It consists of a merger that happened a few years back between the Bay Clinic and West Hawaii Community Health Center. So this is, I think, responsible for, I don't know, like 50,000 lives, I believe, around there. Hamakua Kohala Health Center is another FQHC located in Honoka'a and in Kohala. And then, so you have the federally, health centers, and there's also these other ones called your regional health clinics are also something that falls under a federally recognized payment model. Then you have your private and nonprofit health clinics. So these are your smaller ones that, are in Hilo, in a lot of different places. These are your mom and pop type of, providers. Some are a little bit bigger than others, but it mostly consists of either one or a few, 3 or 4 doctors that create a little clinic, right? So you have Big Island Healthcare, which is under the Big Island Docs umbrella. Makai Health is like a nonprofit similar to Big Island Healthcare, like they have, behavioral health, family practice. So they have a mixture. It's like a patient-centered model of care. In Waimea is Kipuka o Keola. They're a Native Hawaiian. They're actually a regional health clinic, which is similar to what's there, but they're small. But they target your Native Hawaiian population. They focus on Hawaiian homelands or Hawaiian homesteaders in Waimea. But a lot of the healthcare that most of us grew up with, well, sorry, you guys are young. Most, like I grew up with, okay, maybe some of you still belong, like who has a family doctor here? Like one, if you can raise your hand, okay. Who gets their care at a federally qualified health center? Raise your hand. Okay. Who doesn't have a primary care provider here that you know of to the best of your ability? Like who doesn't have? Okay, and sometimes you're looking for one. Sometimes, there's a whole generation that doesn't really need one. They just go to urgent care when they need something, and that's something that I'll talk about later. But for the most part, you have your hospitals, then you have your health clinics, and you have your private or nonprofit type of, providers. And this is kind of like the makeup of what we have on this island. Hang on there. And then, recognizing that Hawai'i Island, again, we're big, we're rural, right? So our population is about a couple 100,000. But a lot of people, like if you live in Kohala and you have something like, you need to see a specialist in Hilo, or if you're in Na'alehu, you got to go to Kona. The drives can be long. So a lot of times just the distances that we have here on this island are barriers to people getting health care. Okay, so I'm gonna move on to what is working. So some of the things that, like if you want to point to like things that are good that is happening in healthcare, well, we've gotten a lot of in this case, we've got a lot of money that was put into our hospital here in East Hawaii. So if you are looking to see what's working well today, well, I think our Hilo Medical Center, Hilo Benioff Medical Center recently got a $50 million CIP funding from the state of Hawaii. So the governor had released this money that's to the state ledge. But also this gentleman here is Mr. Benioff, who now, his name is there now, but he gifted $50 million, right? So they're expanding our hospital, right? So our hospital, right, the demands on them has been growing, right? And again, it goes back to the demand for care is going up. Why is that? Chronic disease, a lot of these things that we'll talk about later, is the reason why there's so much need and demand for healthcare services. But the good thing is that, we've had funding, we've had people that are willing to help, that have put a lot of money into seeing that, East Hawaii has more to offer. So there'll be more beds, there'll be more services that you can find right here in Hilo instead of having to fly to Oahu, let's say, right? Secondly, last year, the last legislative session, there was this GE tax bill that got passed, which is really significant because you remember I told you about private practice, like family doctors it's hard to, keep that business model working today. Well, the GE tax bill, it exempts doctors, the private practice doctors, from paying a GE tax that they cannot recover. So like in most places, if you pay a tax, you would pass it on to your customers, right? Let's say. But in the private sector, they were not allowed to pass that on Medicare and Medicaid patients. It gets kind of complicated, but in essence, it's not fair because every other healthcare institution doesn't pay that tax. Only the private practice, the small guys, have to pay it. So finally recognize that it's not fair. We're going to exempt private providers from having to pay that tax that nobody else pays, right? So that's helping them save some money every year that normally they would have to pay. So those two things are examples of things that are working. If you just look at the Benioff Medical Center, they've recently, over the last 10 years, they've added a lot of different specialties now that you can get there. So if you go up there, they have more buildings now, they have more services, and it's really an attempt to keep more care local, right? So we don't gotta fly, you don't gotta travel, off island now. You can get some of the services here now. What we found with that is that the demands for those services are a lot more than what we thought, right? Because before you know patients that are flying off island for it, you know who they are, but then now you're realizing there's a whole community out there that are coming for these services that you didn't know about, but it's because it never existed here before. So all of a sudden there's a spike in demand. Will that level off in time? It might, but at the same time, if you try to get an appointment at some of the clinics, you might be waiting 6 months, 3 months, just to get in. So that's some of the, the good and the bad of, having more services here. But for the most part, it keeps a lot of people staying here for their services, right? What's sort of not working, right, is, like I explained, is, you can have these services, but keeping doctors here is also a challenge, right? Recruiting and retaining physicians or any health professional has been difficult. So that's one of the things that I think no matter what kind of healthcare organization you are, if you're a clinic or anything else, like hanging on to your staff is hard. Recruiting is very, very difficult. And for the same reasons as a lot of other sectors, your cost of living here is high, right? So you remember we talked about Hawaii being like the lowest healthcare spend in the nation? See, that's why it's hard, right? Because healthcare is reimbursed so low in Hawaii if you're a provider, okay? So if I provide a service, my reimbursement is so low that I can hardly survive, right? Yet I live in the state with the highest cost of living, housing, right? Food, everything. So, that's why doctors don't come here, or they come and they leave. They cannot find a house, right? They might rent for a little while. So there's a lot of things that are going on that is making it difficult, for healthcare in general, right? To expand what we currently have is hard. Oh, also our providers are aging, so that's another thing. For example, my brother, okay, he's on his second half of his 60s, 67, so he's looking at retirement, right? But who's going to fill his spot, right? So this is some of the challenges that we see here, and part of the reason why let's say the hospital model is expanding, like they're hiring specialty care, is because the specialists in Hilo that used to be here, if they retire, there's nobody else already, because nobody wants to. Well, no one can make it in private practice today. It's very difficult. So these other employed models, right, you work for a hospital, is where a lot of people are wanting to work now, right? Instead of starting your own practice, they just rather go work for somebody like this, right? So you don't blame them, and you don't blame the private practice people for being unhappy, because it's just dysfunctional. Right? The payment models don't really reward what you really want them to reward. So anyway, that's some of the other challenges that we have. And again, just as I mentioned, the low reimbursement rates. So our Medicare reimbursement levels is one of the lowest in the nation. Again, in a state that has some of the highest cost of living. Right? So that's the basic dysfunction of what we have. And then there's just equity issues. If you live in certain areas, you just are not going to be close to any healthcare. So long wait times are a result of a lot of this. People still having to fly if you need something right away, and if you can't get into some a place here, you still have to fly. But at the same time, we're making strides, sort of in the right direction, but it's just difficult. So the long story short, and where I kind of want to end, is that building more hospitals, expanding more services here on the island is difficult, right? Because again, there's no workforce, right? You can build clinics, but if you can't find any doctors to fill it, it's like you just got a building, So the key in the long run is not, building more facilities. It's really keeping people healthy, and that's the sort of the Kuleana health thing that we started with today. So the prevention is, the key is prevention, and maybe a more rewarding way to keep our primary care providers in practice, right? Because it's really shifting from the expensive care, which is what we call it sick care, to if you want healthcare, if you really want to define healthcare, healthcare should be keeping people healthy, right? That's primary care and preventative care. A lot of our hospitals today are filled with people with chronic diseases. Chronic diseases, not all of them, but a lot of it is lifestyle related, right? What you eat, lack of exercise. A lot of it can be prevented with simple medication. If you just, see a doctor, you get diagnosed early, they put you on some sort of regimen, right? Exercise, some medication until you can get off your medication maybe. But a lot of it is, if we can make a difference in that area, then I think it'll help us in the long run, not having to, try and, build more and more hospitals, because I don't think that's the answer to healthcare, right? Because again, if you look at nationally what's going on, the whole shift is really more towards keeping people healthy. It has to go that way. So anyway, that's kind of like my presentation. I know we got some questions for you folks, and Kobe, are you going to lead that? Okay, thank you.